cost of drugs. So please enroll on the health insurance. His Excellency just recently, we would like to thank him. He recently actually launched the formal sector. So all civil servants are going to be insured. They'll have their health insurance and they'll start to enjoy the benefits of it.
For the measles exercise, how long is it will take place and between what period of the day? Because you know, some people as early as 7 they have hit the road to go to work and the likes of that. So how many days are we looking at?
So the measles campaign is for 7 days. It started on Saturday and it's going to end on Friday. It's usually between the hours of 7 to 4 because the health workers have to get back home. But we're there over the weekends as well. We've done Saturday and Sunday. There'll also be a mop-up. When we finish on Friday, we'll go back to the field to actually test if we've covered all the children that we plan to cover, and we would immunize and not spend another 2 days immunizing children that we haven't immunized. So we'll probably still be working over the next weekend to ensure that we have a wide coverage. So parents, we won't delay you. I can promise you that within 5 to 10 minutes of bringing your children to our location, you'll be attended to and you'll be on your way to work. Please take the time out to ensure that your child is immunized, and it is free of charge. Please do not pay any health worker anywhere in Ogun State for your child's immunization. And if anybody should ask you for money, please let us know and we will do the right thing. Thank you.
Now, whenever we have you like this in the studio, it's not just for us to discuss what has really brought you here, but it's also to take your thoughts really on other health challenges really that, or threats that we may be having in the society at large. The country, as we speak, in some parts of the country, not Ogun State really, you know, is actually having the threat of cholera in some states really. But again, outbreaks like this, because of the nature, can actually spread very, very fast. So tell us what you have been doing or what you have in place to see that it does not really get to Ogun State, and of course even if it gets here, I mean, effort will be made to really attack it and arrest the situation.
Thank you. I'm sorry to inform you, cholera is in Ogun State right now. We're just not one of the top 10. That's why we're not featured. We've been dealing with cholera in Ogun State since about March. Once the rainy season comes, we have certain LGAs, a couple of LGAs that every year they will have outbreaks because of poor hygiene practices, open defecation, and also the use of wells that are not deep. So when the rain comes, they wash the fecal material into the wells. So we've been dealing with that. My epidemiology team have been out there. We have a rapid response team in every local government. That's probably why you haven't noticed a flurry of activity, because Ogun State has managed to actually institute a system, which means that when there's an outbreak, we don't need to run around. If you notice that recently in the news, we were second in the country to our preparedness for outbreaks. That's because in each local government, we have the rapid response team. When there's a case of cholera, they go, they respond. We have treatment centers in each local government, so designated treatment centers. So where people with cholera, when we identify them, we don't mix them with the general patients. We send them to those treatment centers where they receive free care. And they don't have to pay for that treatment at all, the intravenous fluids and all the things that we give them. And we have a state team that we're constantly watching. There's a screen in my office which I'm meant to be monitoring the signals coming out from the various LGAs, what's happening. So where Ogun State is on top of it. Not only that, we have health educators that go out and train people about the risk of open defecation. It's bad. We should avoid defecating along the river lines or even throwing our defecation on the rubbish dump. if you don't have a toilet in your home, identify one room and convert it. It is a law in Ogun State, and the governor is ready to enforce it. He gave us a period of grace. Last year we announced it. He gave people a period of grace to try and convert rooms in their homes to proper toilets, so that people in their compounds will not have to go out and throw their excrement on the street. And sooner or later, the Environment Ministry will be coming to homes where they don't have toilets. What His Excellency has also done is each time we identify a community where the reason for the outbreak of cholera is lack of clean water, we try and help them, support them with a borehole where possible. Well, we also are treating wells, so we have chlorine tablets to help people. They're available for people to procure to clean their wells. If you're using wells, you can drop the chlorine tablets that sanitizes your well periodically. And we employ sachet water producers to ensure that the water that they're packaging is from a clean source, either portable water, not just bagging waters from untreated wells, because sometimes we see that the cholera might have been an outbreak from contaminated foods. So, and also food, we have food vendors, we monitor them, we license them, because that's one of the areas where transmission occurs, when there's no hygienic preparation of the food. So we encourage every citizen, no matter who you are, to make sure that before you eat, you wash your hands. And if you're eating your fruits, wash your fruits before eating them, no matter where you buy them from. Those are the areas that we pick up cholera without knowing, because you don't know who's touched the fruit before you. And clean environments, cut your grass, make sure that where you cook is clean, and you use water that is clean to cook. And if you don't have good water, make sure you boil your water and cover your water to make so that flies cannot land on it. Food vendors must also cover the food items with nets so that flies cannot land on it. It's easy for flies to go from rubbish dumps onto food and then spread cholera.
Okay, but as a category of people that you have not really talked about, and they specialize in this area of business, evacuation of soak away from houses when it is full. And how effective is your monitoring exercise of these people? Because some of them, when they evacuate the soak away, where do they dump such waste? Yes. Where do they dump it? Is it in the river or just an open space somewhere? And that could also trigger cholera that we're talking about.
So thank you for that question. That would be going to my colleague, Commissioner for Environment. We work collaboratively, we work together, but that's in their purview. I wouldn't know what to, but I'm sure they do a good job, because I've seen them work with us in trying to address the cholera. We work with WES, which is the waste management at the local government level. So we work closely with them, and I'm sure they do their due diligence.
So on several occasions we have had deadline being shifted. They will tell you Millennium Development Goals, now we have SDGs now. Nigeria will set a target of by 2030, this should be eradicated, open defecation should be eradicated, and at several occasions the goalpost has been shifted. Are we likely to see an end to open defecation in Nigeria at all? Because most people, I don't know the percentage of the population. If you approach Lafenwa now, a popular market in Abeokuta, there are two bridges there. When you look through into the river, you see a lot of people defecating into the water. And that water is a major source of material being used by Ogun State Water Corporation to process, eventually they process it, but people defecate into it a lot.
So I think this is multi-sectorial, the ability for any nation to actually put an end to open defecation. So the SDG goal is a global desire, aspiration, is a global aspiration. And Nigeria has signed into that global aspiration. But to put an end to open defecation, several things need to happen. One is public education about the implications of defecating openly. So we, as the Ministry of Health, have to continue to educate people about the health consequences. Second thing is environment. You must work with people to make sure that they keep to the environmental laws of the land. The third thing is the planning. The planning ministry must make sure that they do not approve any home that does not have adequate provision for sanitary wares and having a toilet. If a house does not have a toilet, they shouldn't approve it. And landlords that don't have toilets should be, punished, because it's not the issue of the tenant if there's no toilet there. It's the landlord that has to make sure that he provides toilets. So we'll continue to educate people, and hopefully Nigeria, like other nations, would get to the point that we're not defecating openly and we can secure our own health.
All right, let's put you more on the spotlight now. Your ministry, you've been in the saddle for 5 years and about 5 months now, because you've been the one overseeing the ministry to make sure that the health of state people is well taken care of, and people have access. Under you, the health insurance was launched. We have seen the Yoruba one of for pregnant women, Abidel, the likes of that. Confidently, can you say you are on track executing the mandate being given by the governor who appointed you as Commissioner for Health in Ogun State? If you are to look back in these 5 years and 5 months, that Ogun State is indeed on track. Thank you.
Point of correction, I've been in this seat 4 years and 9 months. just a joke. Okay. And so I'm counting. So And I'm grateful to His Excellency to having given me the opportunity to actually be the Commissioner for Health to serve my people. On arrival, I had many aspirations for the state. One of which was to strengthen the primary healthcare system and make sure that it delivers quality, affordable, and accessible healthcare for the people of Ogun State. If we look at that, I think we're making good inroads when it comes to that. We've renovated and upgraded quite a few primary health centers. We've ensured that the staffing in those primary health centers has improved. It's not ideal, it has improved from where we met it. We've ensured that the drugs, when people do go to our facilities, that they have drugs there. We've put new equipment there. So these are the things that make for a good primary health system. We continue to build on that. Even in the next year, there'll be more primary health centers that will be rehabilitated. That is right infrastructure, right equipment. We're even putting solar, alternative energy, and electronic medical records. So that in itself will make for a good primary health system. But we've gone beyond the primary health system. We're strengthening our secondary and our tertiary. You'll see that Olabisi Obanjo has been equipped as well. Also, we wanted to develop our ambulance services. So our ambulance services has been, when I came, we only had 8 hours from 7 to 3 o'clock. Now we have a 24-hour ambulance service. We've increased our fleet by over 500%, and we continue to increase that. We've launched a rural ambulance service. It's interesting you say that, the question you asked, because at the weekend I was just going through my phone and I found my proposal. When they invited me to serve, I wrote a proposal to the governor, and it was dated the 22nd of October, which will be the anniversary, 5 years tomorrow. And what I planned was I was going to tweet on it tomorrow to say, this is what I said I was going to do for Ogun State 5 years ago. and this is what I've been able to achieve. So I'll be working with my media team to actually celebrate our little wins and aspire for more.
Okay, but you have received knocks in some areas too. When you came out with a tricycle as ambulance in rural area, people wonder how would that be effective? And secondly, lack of personnel, health personnel. A lot of them are living in droves for greener pastures abroad. They are not being replaced. They will tell you a nurse will have to take care of about 50 to 70 patients in an hospital and issues like that. So how are you also working to fill this gap, fill this vacuum?
So with the health workers, it's a global issue. My daughter is a doctor in England, and she complained. Last night she was on the phone with me till 12 midnight saying that, you know, it's not working, they're overworked because there are not enough doctors, where we become a capitalist community globally. So less people doing nurses and doctors. So there are very few of us, and those very few, the health demands are higher globally, more older people, so asking for the need to use a doctor or nurse. So, and it's a human right for people to move if they feel they need it to move. So it's not my knock, it's a global knock that we don't have health workers. But what we've done is we've been innovative in creating extra cadres to make sure that we can fill those gaps. The second thing, the tricycle ambulance, it's interesting you say so. It's actually the most effective because majority of people are not, that need the healthcare are not in the city. There are no roads in those villages. That's what can
Inside of it, can it take a human being? Or
it
that is an ambulance?
Oh, absolutely. It does take it. And it's funny, we've been invited, Ogun State has been invited to Abuja to discuss that, to present our rural ambulance service. This week, we have an excellent, even in order that we've launched a transport system. Many women that would have lost their baby bleeding, they're transported for free on that. So what we should ask is, it's not ideal, but what would have been, what's the alternative for those people to walk miles to get to the PHC? That's what we should look at. Not that it's not the, and how many can we afford of those advanced life support? There are over 75,000, a million naira, those big ones. So how many can we put in the 236? So on that note, I think...
I really don't know if we can still take this one.
Just a question.
Really, the Ogun State Alternate Medicine Board, that was inaugurated some time ago. Much has not really been heard, I mean, in terms of what they've been, their works really.
So because it's a new agency, they're in the planning stage of what they're going to do. They already have bought land. They're doing a lot of research to see what, they're working with people who do alternative therapies to see if what they claim about the drugs is right, or if the medication is right. They're doing all sorts of, they convene traditional birth attendants every year, massive, over 2,000 to 4,000 of them. They've done that every year since they've been created. So there's a lot of activity out there, and we're collaborating with them to ensure that they deliver quality health for our people, and they do not overreach their boundaries.
All right, thank you very much. It's been a wonderful session with the Ogun State Commissioner for Health, Dr. Tomi Koka. Beyond the measures, we have also taken up on a scorecard so far in that ministry, what has the ministry been able to do in the last 4 years plus or thereabout that she has been in this saddle. So we must thank you, Madam, so much for finding time to share your thought with us on the program.
Thank you very much for inviting me.
All right.
I always look forward to the sessions with you.
We will still bring you back. The issue of October 8th to November 3rd, you still need to come and table before the entire public and see what you are bringing to the table. So, I remain Tunde Shodeke, fortunately, piece of the most time for my colleague.
Yes, I'm Dominic Abeokuta. We say thank you so much for watching. Enjoy the rest of your day.